My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer. My gratitude to Union Capital and Craig McClay for making this prostate cancer awareness event possible. The focus of my talk on the AdMeTech Foundation's prostate cancer program, creating a Massachusetts model of national and global leadership in public awareness, medical education and research, clinical care equity, and advocacy. This program was established by the AdMeTech Foundation-led Prostate Cancer Action Council in 2013 to lead advances in patient care, bring them to Massachusetts men, and eliminate health disparities. Our council includes American Cancer Society Cancer Action Network, SECSID, Center for Eliminating Health and Social Inequities and Disparities, Change, Community Health Awareness Network Growth Equity, LHIP, Latino Health Insurance Program, Massachusetts Prostate Cancer Coalition, MOCA, Men of Color Health Awareness, multiple branches of an AACP located across the state of Massachusetts, and independent Blue Ribbon expert panel consisting of the key experts in clinical care and research at the leading state's hospitals. The primary focus of our program is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. The goal of my talk is to review recent advances in screening, diagnosis, and treatment, and our prostate cancer equity resource project, expediting transfer of the cutting-edge patient care to Massachusetts men. In men, prostate cancer is the most common major malignancy and the second leading cause of cancer death. Prostate cancer is as common in men as breast cancer in women. Prostate cancer strikes 1 in 8 men, breast cancer strikes 1 in 8 women. For public awareness and education, our messaging has centered on the importance of screening and early detection, critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive during the same period of time. The centerpiece of AdMeTech's medical education is annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. The latest annual summit took place in October 2024. This educational event showed rapid advances in patient care. In screening, our summit supports clinical practice guidelines recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and their leading experts. High-risk men, including Black men and individuals with family history of prostate cancer, are recommended to initiate discussions with their doctors about screening with PSA blood test at the age of 40. Other men should consider screening at the age of 45. The first, or what we call baseline, screening test in younger men is important for identifying men at risk of lethal prostate cancer longer term, 10 years and longer. In diagnostics, we have seen emergence of very accurate non-invasive tools, such as blood, urine, and saliva analysis for molecular and genetic testing, and advanced imaging, including ultrasound, MRI, and molecular imaging. These advanced non-invasive diagnostics highlighted the importance of prostate cancer screening and shifted past concerns about PSA blood tests into a dustbin of history. For example, these diagnostics can determine which individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection, critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized care for each man, including careful observation or active surveillance for men with slow-growing, low-risk cancer, minimally invasive intervention or partial resection of the prostate for men with intermediate risk cancer, or radical invasive procedures for men with high-risk cancer when the entire prostate is removed. High-risk individuals, including men with Black heritage and family history of prostate cancer, carry higher risk of both death and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics such as advanced imaging, MRI or molecular imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any testing is available to determine if these procedures are actually needed, and if yes, what kind of options would be best for him. It was interesting to hear at our summit from multiple experts that of all diagnostic tools, imaging has become the game changer, resulting in improved diagnosis and treatment of life-threatening prostate cancer, while decreasing unnecessary biopsies and treatment for slow-growing, harmless disease. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research, development, and large-scale implementation of prostate MRI since 1998. In 2013, AdMeTech led clinical trial of prostate MRI, which produced groundbreaking data that were presented at the summit in late 2016. 6 months later, in early 2017, MRI was recommended as the new standard of patient care prior to biopsy and treatment. Similarly to breast cancer, precision imaging paved the way not only for precision biopsy, but also for image-guided, minimally invasive treatment for prostate cancer. We call these procedures focal because imaging makes it possible to focus treatment on cancer while sparing normal prostate tissue. Minimally invasive treatment of breast cancer or lumpectomy replaced radical mastectomy in most women. Similarly, minimally invasive focal procedures for prostate cancer are expected to replace radical surgery in many men. These procedures can be performed in outpatient clinics with minimal complications, discomfort, and costs. Our summit highlighted the importance of MRI in Black men who tend to have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsies performed without accurate imaging. In men with prostate cancer, there are two pillars of the current diagnostics, MRI and genetics. While MRI shows cancer location and local spread or stage, genetic analysis of cancer tissue reveals underlying biology and probability of progression. Emerging data indicate the importance of genetic testing in high-risk men, for selecting the most effective treatment. With this precision diagnostics, we can now accurately determine if each individual has a slow-growing cancer and needs only careful observation or minimally invasive procedures, or an aggressive prostate cancer requiring immediate, life-saving radical treatment. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread and detecting return of prostate cancer after treatment. For example, molecular imaging with PSMA has become available at the Dana-Farber Cancer Institute since August 2021. On the left, we can see a regular traditional bone scan that shows no metastatic spread. On the right, however, bone scan with PSMA molecular imaging demonstrates extensive metastatic disease. This information is critical for selecting appropriate treatment. We are proud to have led research and development of molecular imaging for the last 25 years. Our summit concluded since 2021 that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care for all. More recently, experts at Beth Israel Lahey joined this effort. Supporting organizations include Latino Health Insurance Program and multiple branches of the NAACP located across the state. Any Massachusetts man age 40 and older can take part in our program. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This project helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our Prostate Cancer Equity Project will be able to eliminate health disparities. Experts of the Prostate Cancer Equity Project can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer to informing men about all available options before and after screening, biopsy, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of three main components. First, AdMeTech Foundation team members collect basic information and match individual patients' needs with the appropriate state experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, and if needed, financial assistance. Third, if an expert recommends any next steps, such as, for example, testing or treatment, AdMeTech's team and patient navigator work with men on the appropriate follow-up. I'd like to provide a few recent examples of how PCE Resource Project has been making an impact on individual men. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. David Einstein at Beth Israel Lehi, who agreed to provide a second opinion. In February 2025, this man and his wife had a visit with Dr. Einstein, who provided a consultation and contacted the original clinical care team to ensure a coordinated approach. In March 2025, patient and his wife described that as a direct result of their visit with Dr. Einstein, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard of Brockton NAACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. I got concerned, and after the meeting, contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted me, and I suggested for him to consult with Dr. Kwok-Ding Trinh of Mass General Brigham, who can assure the best of class care, including high-quality MRI. George has been so happy with his care that he became an advocate for our PCE resource. In late 2024, Dr. Trinh moved to Pennsylvania due to academic promotion. In early 2025, per George's request, we referred him to another leading clinical expert at Mass General Brigham who is taking part in our program. Emma Coyard serves as a manager of the Prostate Cancer Equity Project. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, who helped us with the event today, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.